And then we get into 6.2. 6.2 is talking about those physical senses in driving. So first we talked about those mental and emotional things, and now we're going to move on to our physical senses. So we know that our physical senses would be seeing, hearing, smelling, tasting, and touching. Okay. Your senses help you to stay alert of changing situations. They give you a better chance of maintaining control of your vehicle and minimizing your risks. We've talked about for a long time that 90% or more of the information you get while driving is received through your eyes. Okay, your eyeballs are going to tell your car where to go. Your eyeballs are going to identify all the hazards and help you to process what's happened. You need to be able to see clearly and quickly identify closing zones in your intended path of travel, so where you're going. Okay, your brain directs your eyes to focus on objects in and around your path of travel. Information is sent to your brain. It's combined with stored information to allow you to identify those hazards, predict the conflicts, decide to maintain or adjust your speed and position. And then we know, just do it. Execute your decisions. In other chapters, we talked about that the ability to see clearly near and far is called your visual acuity. Okay. You need to be able to see far. You need to be able to see near. We know that an eye doctor or a person with quote unquote normal visual acuity is called 20/20 vision. Okay. In order to pass the eye test, though, they have to see with 20/40 visual acuity. Okay. Realize that 20/40, it takes them twice as long, and they need to be twice as close to an object to see it as clearly as someone with 20/20 vision. Okay. So 20/40 is what we need to test you for. And what the DMV is going to test you for. But the reality is, you probably should get your eyes checked out. You are driving a car now, okay? 20/20 is where an eye doctor, that's the goal of an eye doctor, to get you to see 20/20 with correction, not to 20/40. Okay? I'm going to try this out. So when I talk about different things, I always want people to visualize. So we talk about our field of vision. Well, this whole area, I know you can't see as well, but this whole area is going to be our field of vision. Okay. Looking straight ahead, most people see about 90 degrees, so about 180 degrees. But there are different kinds or different parts of your field of vision. Okay. Different parts of your field of vision. So while I'm looking straight ahead and basically like right here, that's going to be my central vision. So about 10 degrees. And then from 10 degrees on, okay, is going to be our peripheral vision. It's sensitive to light, it's sensitive to motion, and just like we've said with our blind spots, you're going to start to almost feel people in your blind spots, and that's coming from your peripheral vision. Okay. We also talk about the part kind of in between here called fringe vision, and it's close to your central, and it's right before you get to your peripheral. Okay. Side vision is used to monitor a zone condition after it has been clearly identified in central vision. So again, we've got field of vision, central, fringe, right outside, and then we have our peripheral vision. Good. Okay. The upper parts of your fringe there can detect changes in a rear view mirror. The lower part is to monitor reference points for vehicle positions. A narrow field of vision, 140 degrees or less, is called tunnel vision. Okay. People who have tunnel vision need to compensate with just by moving their head. It used to be an addition of a side mirror, but now all cars have side mirrors on both sides, so you're all good. But they can compensate. There are people who see way less than 140 degrees, and they may or may not be able to drive a car. Okay. Good vision in driving includes our ability to look at colors and depth. Knowing our limitations while driving at night in glare or at a highway speed is going to be helpful. I am a glasses wearer. I can see pretty much nothing without my corrections. And at night, as I've gotten older, especially, my night vision is not good. Glare coming from other cars reduces my vision a little bit more. It impairs my depth perception. But these are things that I know about myself. And I don't drive on the highway at night, or I don't drive in a not lit area. It just helps me out, and it reduces my anxiety and stress towards the driving. An inability to distinguish colors is called color blindness. Okay. Red, green, and yellow are obviously big colors that we use. Okay. The most common type of color blindness is red and green. And people who are red and green colorblind, and usually this is a male inherited trait, but usually people who are colorblind doesn't mean they don't see the colors. They just see the colors differently than you and I, who are not colorblind, would see them. So they'll compensate. They'll remember the order of the lights. So remembering that it's red, yellow, green, or if they go down south where they flip them on their side, it's going to be read like a book. So it's going to be left to right, red, yellow, green. Okay. They need to know the shapes. And this is why we ask you about the shapes and about what you're seeing. Okay. Just being aware, hyper vigilant about using your IPDE. Okay. Depth perception is that ability to judge distance between yourself and other objects. Okay. We need to figure out how far that car is, judging a gap, following that 3 seconds. How do I know how far 3 seconds is? Just being aware where the line is, where the ball is, where anything is going to be your depth perception. And I kind of mentioned I have some issues seeing at night, which is that inability to see. My doctor says I should be fine and it should work out, but it still is something that concerns me a lot, especially just in dark places that don't have a lot of light for me to readjust. And, as you get older, friends, these are things that start to go away. Okay. At night, you might have difficulty reading signs, roadway markings. I mean, look at the differences in the picture. I used to be able to see the people really clearly, and now I see kind of a blur. I see kind of a smudge going on over there. I could see, the clock. I could see everything. And I knew what the cars were doing just a little bit better in the daytime. Glare occurs in the daytime when bright sunlight is reflected off shiny surfaces, and the term glare resistance describes the ability to continue seeing when looking at bright lights. Okay. At night, and this is what I've talked about, glare from headlights can be as dangerous as glare from sunlight. Okay. Night glare caused by headlights, bright lights, high beam headlights, all of those things are going to affect your glare resistance. Okay. And that's what I just said there. And then we think about glare recovery at time, okay? This is actually what slows down as you get a little older, and that's why I have the night problems. But glare recovery time describes the time your eyes need to regain clear vision after being affected by glare. Think about when you were in a classroom and you've been watching a movie the whole time, and your teacher at the end of class slams on those lights and the whole class goes, ugh, right? Because your eyes need about 5 to 10 seconds to readjust. Um, or think about when you go to bed and you turn all the lights off in your room and it's pitch black, but then you wake up or you hang out for a little bit, and you look around and all of a sudden you can see clearly because your pupils just needed that time to readjust. Okay. Try not to look at those bright lights. Use your side fringe vision rather than your central. So remember, that's still central, but it's right on the cusp, right on the fringe of your peripheral and your central. Okay. Wear sunglasses. Adjust your rear view mirror for night use, which a lot of them do automatically now. Okay. At higher speeds, field of vision is going to be narrowed. Okay. At 55, which is, standard highway speed, your clear side vision area is less than half as wide as at 20 miles an hour. Okay. The blur you're going to see, that's your speed smear. Okay. It makes it like tunnel vision. Okay. Your central vision decreases, your peripheral vision decreases, objects to your side become blurred. Think about those car commercials that, it looks really cool, them driving really fast, but when you're actually doing it, it might not look quite as cool to you. Okay. Then we have obviously hearing. Okay. Hearing can alert yourself to something that you may not be able to see. Okay. When I hear emergency vehicles, I try to figure out where they're coming from. Okay. How do I need to move over? What do I need to do? You might start hearing, something squeaking or crackling or, something hanging down. These are things you need to listen for. Driving with closed windows, with stereo or headset, okay, makes you unaware of critical traffic sounds. And of course, we know talking on a cell phone, excuse me, as chapter 8 comes in, is going to create that distraction, but it's also taking away your sense of hearing at that point. Smell, you can identify an overheated engine, overheated brakes. It can be an early warning of the presence of deadly gas. Okay. Your sense of motion gives you clues to the movement of your vehicle. So if you think about it, when you're driving in a car and you kind of know someone is slowing, you almost feel yourself kind of brace down so you can take that turn. You veer a little right or veer a little left. Okay. And you kind of feel that. Okay. Any of you have pets that you don't really secure in the car? And we all laugh when we take a turn and you knew what was happening. So you kind of braced down and your dog flew across the entire car. Okay. That's that sense of balance. Your car could be vibrating. You could have a flat tire. You might have to, the road surface changed, mechanical problems. All of this is with your all of this is with your central or your sense of motion. Okay. And then the last section we're talking about is physical limitations. Okay. It's a diagnosed physical or mental impairment that interferes with or prevents normal activity or achievement in a particular area. Okay. I have to emphasize diagnosed because diagnosed means a doctor has given it to you, has told you that you are, incapacitated in some way, mentally or physically, and has this documented. Okay. People learn to respond to different disabilities. Okay. Fatigue. Being tired is just as bad, if not worse, than being drunk. Okay. Mental or physical work, emotional stress, or loss of sleep can cause fatigue. Being a teenager, I feel, causes fatigue sometimes, right? Okay. It lessens your ability to perform tasks. Okay. It dulls your senses. If you're tired, you need more time to use the IPDE process. I want you, and I'm talking tired. So I want you to think about being in the classroom or looking at your computer and someone's talking, and even though it's interesting, you find yourself doing the head bob. So, your eyes are closing, your head's starting to go down, and then you kind of pop up. Now imagine that while you're going 65 miles an hour down the highway. Not fun. Okay. It can also cause just minor, not minor, but cause drowsiness. Drowsy driving is estimated to cause at least 100,000 collisions each year. Okay. And this is where you get that head bob, that drowsiness. Okay. If you can't stop yawning, your eyes are closing, you're doing that head bob, you should not be driving. And the only thing to help this is to rest. Okay. You can take a walk around, take a stretch, be active, listen to the radio, talk to your passengers, stop in a safe, well-lighted place if you feel you can't drive safely. Try to take a quick nap. Try to take a little 20-minute snooze, okay? Your safety is more important than your timing, okay? And then we have temporary illnesses or injuries. Any illness, a cold can impair driving to some extent. Okay. When your brain is in a little bit of a fog, you can't concentrate on driving. Okay. You have a broken bone, a sprained ankle, something is hurting. It can impair your driving. And then those medicines can increase your chances of being in a collision. Okay. Be aware of the side effects. So if remember when we took the permit test, we asked the question, is there any drug that you take that can interfere with safe driving? And these are not really your day-to-day, but we're talking heavy narcotics that are going to make you sleepy, things that are going to dull your senses, even something as simple as a Benadryl. Okay, Benadryl knocks me out. Benadryl knocks a lot of people out. You can't just take Benadryl and start driving a car, or a NyQuil. Okay. A lot of medicines have side effects, and that's what I just said. So just read the label. Be aware of how you're personally affected by those medicines. And then I already said earlier with deadly gases, carbon monoxide is our big one. It's colorless, odorless, it's tasteless, it's deadly, colorless, odorless, and deadly. It's present in all engine exhaust gases, okay? A lot of times you can detect it because the gas mixes with the other exhaust fumes that do have an odor. Even if you don't smell it, it might still be there, okay? Carbon monoxide can cause drowsiness, headaches, muscular weakness, mental dullness, nausea, okay? It will, basically people who get carbon monoxide poisoning, they go to sleep and they don't wake up, okay? Because it's just a silent killer that way. And smoking is, while you're driving, super dangerous because it also raises your carbon monoxide levels and reduces the oxygen in your blood, okay? And this goes with any form of smoking, okay? So vaping and cigarettes and all of those things. And it can affect your passengers. Finally, we talk a bit about permanent disabilities, so things like epilepsy, blindness, loss of a limb. These are considered permanent disabilities, are conditions that cannot be cured or improved. And realize that the only people who cannot get a license are people who are legally blind. Okay. I can't see without my contacts or my glasses, but I'm corrected to 20/20. People who are legally blind, again, doesn't mean they don't see anything, but they might be so limited they can't be corrected to a point they'd be able to see. Okay. I said with the tunnel vision, there are people who see way less and they are considered legally blind. But people who are deaf, completely deaf or hard of hearing, they can drive a car. The only people that cannot are people who are considered legally blind. So they cannot see 20/40 looking straight ahead. Okay. People, paraplegics, pretty much everybody else can drive. Cars can be modified in such cool ways now that allows people with permanent disabilities to drive, to maintain independence, and to help themselves. Okay. And then a chronic illness lasts for years. So heart disease could seriously impair a person's ability to drive. In some states, type 1 diabetes or type 2, if they're out of control, you might not be able to get a driver's license without a doctor's note. Okay. Some require regular medications, they cause side effects, but you will have to get medical proof that your illness is under control, that you're okay. Like you need to be seizure free for 6 months in order to obtain a driver's license and have it be valid. Okay. Sometimes they have to test more frequently. You know, there's a lot of different things that go along with it. And remember, you know, as we age, our reflexes slow down, our vision is dulled, our concentration, everything becomes a little different. And a lot of people who are aging are on some sort of medication to keep them ticking. It's been lovely to talk to you and to teach you about emotions and the impacts of driver condition. Have a wonderful day.